Hi, everyone. I wanted to go over in a little bit more detail about the autism press conference today. First of all, it's really important to understand there were three key people involved in this press conference today. There was our actual HHS physician cabinet members, and that's Dr. Jay Bhattacharya, Dr. Makari, and Dr. Oz. And they were very careful with their words. They were very measured and purposeful in what they said and didn't say, which we would expect from scientists. And their statement, which came out with the 3 bullet points of what they wanted to cover, I really support. They talked about Tylenol use in pregnant women and children. They talked about leucovorin and the importance of folate in the brains of patients with autism and folate receptor antibodies. And they talked about investing more money in getting us answers, which I think all of those things are things we incorporate and believe in our office and feel really strongly about. There also were the political appointees. So there was RFK and Trump, and a lot of their comments, as often happen, were not as scientifically based and as perfectly worded, to say the least. And so I wanted to kind of go over the groups of recommendations separately. The other thing is there were parents there. And one of the mothers was a mother of a child with profound autism who, is very low functioning in their ability to carry out life. They cannot communicate. She said that they can say words, but they can't communicate their needs or really understand what other people are saying to them, which is really hard on a child and hard on the family and hard on everyone involved. The other family, she described her son as high functioning, which some people do and don't like that word, but it's the best thing that we have right now for patients with IQs that are normal and that will probably hold jobs one day. And she described her child as having more profound when they were young, and she didn't talk about it a lot, but she discussed, that they had worked on helping him get healthy over time. And I think this represents some of the families with autism. And then there's also a cohort of people who feel like autism is part of their identity or personality, but they are employed and they have families, and sometimes they get offended by these conversations. I think the most important thing that we need to talk about is that this lumping of all of these different types of people with the word of autism is really difficult for us to have good scientific conversations, good social conversations, good policy decisions, and even good conversations within ourselves about what are we dealing with and what do we have. And so for me, the families that really worry me are patients with profound autism and those with a lot of medical complications, because those are my job as a physician to work on seeing how we can make them feel better. There's a lot of downplaying of both the parents and the administration's efforts to help the autism issues in America by saying that we don't have rising rates. And some people say it's more expanded diagnosis codes, better identification is what's causing our rate increase. And while I do believe that a good number of the cases that we report would not have been reported in generations before, it's also true that our rates of more profound, significant autism are raising. And that's not even hard. I mean, I've read the studies and I've looked at the data, so I do know the raw data on that as well. But from just a basic standpoint, if you look around your community, I know when I was a child, I didn't know any children with autism the way that we see it now, and everybody knows somebody with a child who's pretty significantly affected at this point. And so it doesn't take a lot for the citizens of America to say, hey, we have our problem and we would like something different to be happening. And it is worrisome to parents to see their neighbors, friends, nieces, nephews be affected by something and then not really have answers. So I am thankful we're going to put more research to bear, and I think we have a lot of answers to a lot of questions that need to be answered. I've spent a lot of time in this data because I work with the Autism Research Institute, and I do various different things where I get to see a lot of the data. And I know there's no one cause of autism. That's definitely for sure. I take care of unvaccinated children who still have autism. I take care of patients who have clearly genetic causes of their autism, children who have had brain injuries or infections that cause their autism, and patients who are seemingly no answer that we can find for why they have that. We have patients that are born the day they're born with delays that then eventually have an autism diagnosis, and we have patients that we know that appeared to be developing normal and had what we call regressive autism, where they lost skills they previously had. These are all very different, and they have different causes and different reasons for why they occur. And we're not going to ever find one answer. But I do hope that we continue to kind of pick away at the things that we do know. I personally, if I were to tell my families or the people around me, what do I think is the number one cause to the rising rates, I feel strongly, and this is just my opinion based on the data that I've seen and studied for years, is I really think our microbiome is the ground central for why so many of these things have changed over time. It is the one thing that has changed quickly in 1 or 2 generations within our population. Our genetics don't change that quickly. But between our food supply and antibiotics and various different other things, it really does, you do look at our biome as being quite different than it had before, and that interacts with everything. It interacts with our brain, our immune system, our detoxification systems, and I think a lot of the different causes of autism intersect with that. And so hopefully we'll have some government attention to that and some research and development into that as well. There was none of that discussed today. There was one part today where President Trump kept discussing the Amish communities having no autism. There's a couple things I want to say about that, especially on the backs of the microbiome. Dr. McCary was very careful to say there are groups of Amish that vaccinate and there are groups of Amish that do not vaccinate, and both groups have very low rates of autism, and that's one of the main reasons why I feel like microbiome is far more important. The research into the microbiome and its effects on our immunological and neurological system are pretty profound, and we've known for a long time that families that are farming communities who have exposure to germs and animals and dirt a lot have very low rates of certain types of illnesses, and autism is one of those. And that's one of the reasons why I point to microbiome as being our big factor. So there was a statement at one point where President Trump said those are the people who don't do anything. They don't do medicines and they don't do vaccines, and that's why they don't have autism. And I would just caution that is one of those correlation, not causation issues. There are populations in the general population who do very little vaccines and very little medicine who still have autism. And there are patients that work on farms and with animals and everything that have very low rates of some of these illnesses, and they do vaccinate. And so we have to be really cautious about making broad statements like that, so I wouldn't support President Trump's statement on that. But I do think it's a very interesting thing that we should be studying on why our patients do well when they are in these more natural environments that are more complicated than just vaccines or medicines or Tylenol or vaccines. So I hope that's helpful. I'll try to continue to go through the transcript today and give you more information about things that were covered. There were several things that were kind of tricky, but these were the biggest highlights. If you're interested in a folate receptor antibody test, our office does carry those, and we do test for that. We write for leucovorin, but the result of the FRAT test does affect the dosing associated with the leucovorin, so we always prefer to know whether you have these antibodies that Dr. McCary was talking about in the press conference, and so that'll be helpful to us. If you want us to find out your FRAT antibody testing, our staff can do that. As far as Tylenol goes, we're going to stick to the same story we've been saying for 20 years and is already on our website, which is we should use Tylenol in very much moderation unless you absolutely need it. We prefer ibuprofen for fevers, and our fever guidelines are on the website. So if you're ever wondering, well, what do I do if my kid is sick or has a fever or has pain, we do have some pretty detailed fever guidelines on our website that focus on ibuprofen use and limited Tylenol use. Obviously, we'll be around for any more questions that you have, and hopefully this is just the beginning of more research and more things that will be coming towards us from our HHS team of Dr. Jay Bhattacharya, Dr. McCary, and Dr. Oz. Thanks, everyone. Bye-bye.